Hey, it's Katie. Hello, everybody in Facebook land. I am here at Fox Valley Plastic Surgery, and I want to introduce you to, is it a new technique or has this been around for a long time?
It's a new technique, and it's really a new technology as well.
Okay, so we are at Fox Valley Plastic Surgery. We're in Oshkosh, and we're going to be doing Emsella, and I'm here with Lisa and Nancy, our patient, and we're going to actually get to witness how this happens and how they do it, and I'm so intrigued by this. Women, men, this is useful for everyone, but I would say especially moms. Moms, if you have given birth, this is an issue that you may have had. Jumping on the trampoline with your kids, or that sneeze and that little extraness comes out that you don't want. This is the answer to your problems.
Well put, little extraness. I love that, yeah. Emsella really is a device that works on your pelvic floor muscles. And as a result, we are able to maintain better control of our bladder. As well as we have had patients report that when they have had some constipation, chronic constipation issues, they've actually had some relief from that. Again, I'm assuming because of that strengthening of the pelvic floor would help propel. So anyway, yeah, it's a great technology that does work on different types of incontinence, both stress incontinence and urge incontinence. And urge being more when I have to go to the bathroom, I better get to the door really quick and go. That's more of an urge incontinence. Stress incontinence is what you're talking about, the trampoline, the jumping jacks, the running, the sneezing. So we've had success with our patients with both of them. And we're just super happy that we can't even tell you what kind of response we're getting from our patients. It's been phenomenal.
Yeah, I was going to say, listening to that, and it's Katie, so I just tell you the truth. I would say I fall more in the urge incontinence category. Yeah, so I'm more like, oh crap, ever since having my child, 6 years ago, I'm the one going, oh crap, I better get to a bathroom because it's coming out. Yeah. So we have Nancy here who is going to basically demonstrate for us. And you had said it's a 30-minute procedure?
Actually, you're on the device 28 minutes. Okay. Mm-hmm.
All right. So show us how it's done.
So we have the patient sit on the chair. The company that manufactures this is called BTL, and again, the chair is called Emsella, and it actually uses a technology that's very similar to MRIs. It's a magnetic field technology. It's technically called high-intensity focused magnetic energy, and so very similar to that. When we position our patient on the chair, we want them to get, I think, a little further forward, Nancy. We really want the major feeling of the device. Here we're using some not so comfortable words, but
we're all adults.
Yes. For a woman, we want them to feel the most intense feeling of this between their vagina and their anus. For men, between their scrotum and their anus. Okay. That's where that pelvic floor is most resides. So, and again, the device is going to deliver 12,000 supramaximal contractions, so contractions of that pelvic floor. And women, especially, we call them Kegels.
Okay, time out. Kegels? Yeah. Okay, because Murphy, the man, claims we have this huge debate. He calls it Kegels.
I think it goes either way.
Come on. Okay. So anyway, they were saying, though, it's equivalent to how many?
12,000.
Oh, my gosh. I'm doing them right now. I couldn't do 12,000 at that time. Are you doing them with me?
So if you don't mind, I'll start.
Yes, absolutely.
So the first part of doing this, Nancy, is just not going to be the treatment. It's literally going to be a feeling so that we can position you correctly. Okay. So
everyone's about to get intimate with Nancy.
I'm going to start all the way. I'm going to first measure where you're sitting and how your legs are. I think I'm going to raise that chair up just a little bit. We want the patient to be, I'm tall. Yep, she's a little taller. So I want her flat-footed with pretty much a 90-degree angle in your legs. Does that feel about right, Nancy?
Yes.
Okay, yep. Good. The next thing I want you to do is feel that clicking and see if you can position yourself properly. Again, we're all adults here, but it sometimes helps to separate cheeks a little bit so we get more of a full response with that pelvic floor. And the other thing that Emsella recommends is that knees be about shoulder width apart, although we've had patients really respond when they're even a little further. So about that looks right, Nancy? Yep. So how do you feel?
I was going to say, is it happening right now?
It is happening right now.
This is it, it's happening. So, okay, is this one of those chairs that you could see like a ton of celebrities having in their basement? And okay, is there a point where, how often should you get this done? Is there ever a point where it's too much?
No. Well, I should say yes. It depends, though, on the level of incontinence. So actually, I'm going to start, Nancy, because we're not technically doing it yet. This was just positioning. Okay. So if you don't mind, and then I'll answer that. So now, Nancy, I'm going to start with a lower percentage, but the goal is to get you to 100%. Okay? So I'm going to put you at 50% and see if that's tolerable for you. Most patients have no issue, and we can get them right to that 100% maximum output right away. Does that feel reasonably comfortable? You don't have any pain? No. Okay.
Would you lie to us?
I would not lie to you.
I would try to be so bad, Ash. I'd be like, oh, it's fine. It's fine.
Okay, I've been slowly bringing her up. We're now at 73%. Still feeling okay? Yeah. Feeling like I can increase that intensity a little bit? Okay.
Is it constant?
It is not constant.
You can hear it's kind of moving on and off.
Okay.
And there will be series of clicks that change that will be actually releasing the lactic acid that forms during the procedure. Because as you stress a muscle, of course, we know how lactic acid does form. So the good news is the procedure releases that lactic acid so that you're not sore the next day.
Oh, awesome.
So, yes, very similar to our M-Sculpt device. So, Nancy, you're now at 100%, and that still feels fine for you, right? Yes. No pain? No.
Okay, in my head, this may be a really dumb question. In my head, I feel like, you know how some people get rejuvenation?
Yes.
Is this even touching that area, or
Yes.
like I guess that's mean how, is there ever too much, like could you get too tight? I guess is that.
I imagine that is possible, but this device isn't really tightening the vaginal walls, which is really what rejuvenation is more doing. This is strengthening the pelvic floor. So, and the pelvic floor holds up that bladder, it holds up in women the uterus, the colon runs through it. So it's really strengthening that area instead of the inside of the vaginal walls. So,
this is so intriguing to me. Are we getting any questions on Facebook Live? Because okay, just if you have questions, feel free to type them in and we'll answer them. And I know it's not anonymous, but we're all adults here. I already told you I'm an urge incontinent, so we're all friends. I guess.
Well, and you had asked me about how much a patient can do. Mm-hmm. Everyone has a different level of incontinence. We have some patients who are severely incontinent. We have some patients who are really early with the incontinence, and for those patients, we kind of consider this insurance.
Okay.
We can treat that. We can make the people who are maybe having to cross their legs because I'm sneezing.
Okay.
There's something that a lot of women get that they don't really even know about or talk about, but it's part of incontinence. It's called post-void dribble.
Okay.
And it's when you're done using the restroom and you stand up and you just get a little dribble and you don't really know what happened.
Can you fix my 6-year-old son? I was gonna say, can we fix my husband on that?
Right, exactly. So for those early sufferers of incontinence, this is a great way to keep yourself.
Okay.
It's a great way to keep yourself from getting worse.
Okay, so this is solving questions though, because we have some people I know in our facility that needs this, because I've always been amazed when I go into the women's room and I'm like, how is there pee on the seat?
Yeah.
Totally. So we have people in our building that need to get this done.
Yes, and you are right. This is not only women, this is men. We are treating men. They have the same pelvic floor and they have the same bladder. So, they have a little bit more. But obviously, this is a situation that men absolutely benefit from as well. And the point that we're at now, Nancy, this is that part where it's releasing the lactic acid that has been building up from those contractions. Right. You think about doing 12,000 of anything, you're obviously working those muscles very hard. And this takes care of that lactic acid right away. So the only thing that patients report, and I have experienced myself, is just very minor, I would say upper gluteal, slight tenderness, and I don't mean soreness or muscle fatigue, just a slight feeling of, I was sitting on something or something like that. But again, the longer you do that, the less you really feel that, because those muscles are tightening up.
And how long would that last?
A day.
Oh gosh,
I'm
yeah.
talking a day.
It stops you from
Maybe even a
dribbling in your pants. I would. You can handle it.
Totally worth it. Absolutely. So patients can do this. A typical time frame is we would like to have a patient do 6 treatments.
Okay.
And we would do 2 a week for 3 weeks. Then, depending on their level of incontinence, if they're a pretty severe sufferer, we might bring them back and do, a couple more sessions. We might bring them back and do another series of 6. Most patients, a series of 6 treatments is looking like it's the right amount. And then follow-ups, I would say in 6 months for sure, a one-time follow-up to make sure we don't lose that muscle development that we've gained from those sessions.
So in a follow-up, are you just asking questions, or is this like a full?
So we do both. Okay. At 3 months, we actually do a follow-up where we have them meet with our lifestyle therapist or therapies division nurse practitioner. Okay. She's going to do all the deep questioning, find out what kind of level of improvement they've gotten. But in 6 months, we're actually going to bring them back for another treatment, just like today. And then again, it just depends on how they've responded initially, how we expect them to continue to respond.
So this is fascinating. Again, we are at Fox Valley Plastic Surgery in Oshkosh, and we are trying out I'm not trying it out right now, but the Emsella machine that they offer here. So if someone wants to get in contact with you guys, ask more questions, or set up an appointment, what should they do?
They should give us a call. The first thing they would do, if they're interested in this technology, they should make an appointment with Lauren, who again is our nurse practitioner who sees all of our lifestyle therapies patients. They would see her for about a 30-minute consult, and there is no charge for that. She would make sure that they are an appropriate candidate for this technology. There are some things that might not make a patient an appropriate candidate. If someone has a implantable pacemaker, some sort of metal in their body, there are certain types of metal that we can deal with, but we have to go through that process and make sure there are no contraindications. If they're not, then we get them scheduled for the procedure.
How soon can someone get in?
Because this is a quick procedure, we have multiple people here who do the treatments with patients. It's pretty quick. We've been able to get patients in, same day.
Oh, that's awesome. I'm someone who likes to get it done right away. Yes. Like if I would call and they'd say 6 months, I'd go, I'm done.
I understand. Yeah.
I'm good.
Yeah. So obviously,
I'll just continue to pee myself.
We don't want that to happen.
And Lisa, someone's wondering, they're confirming clothes on for this.
Yeah.
Yes, this is exactly the treatment. This isn't like the downgraded treatment or anything. I was shocked about this too, because in my head, I was picturing like a bidet, no pants, and then I realized that this is Facebook Live. But no, this is exactly, were you surprised?
I'm doing well. I was surprised. I was thinking a gown or I don't know, but this is easy.
Yeah, because unfortunately this is an uncomfortable topic for people, and this is actually a really comfortable procedure.
It is.
So there's no shame. There's no shame in this game.
And really, like I said before, I can't even explain how much of a difference this is making in women's lives. We do a lot of wonderful things here that improve a patient's looks and how they feel. But this device is truly changing women's lives. And that's what we are so excited about. Women and men, although we're seeing mostly women, because as we said, this affects more women. In fact, studies are showing anywhere between 50 and 80% of all women suffer from some form of incontinence. So that's a huge number. Yeah, so we're over the moon with this device, and our patients are loving it.
And Lisa, real quick, I read that, is it 95% of women that have this done are experiencing better quality of life?
Well, in our office, I would say 100%. But there are certain things that may make a patient resistant to the improvement. For
Well,
example,
and let's put out there, no one's happy all the time.
exactly, right.
always has complaints
Right.
about everything.
Right. There are certain situations, if a patient has had radiation to the area, that tissue is less likely to respond normally because that tissue's been, destroyed to some degree. So, so far, because this is new with our practice, we're just having, like I said, fantastic results. So, and back to your patient or your viewer who asked about clothes on, the only thing that we don't have while we're on the device is metal. So if Nancy was wearing a watch, she took off her ring. She had already done that before coming in, already knew to do that. But
And you can't sit on your phone.
no, there's no sitting on your phone, your device, because that would actually, it could blow up your device.
Oh,
We don't
dear.
want that, yeah.
Okay, so.
Very similar to an MRI. So.
All right. So again, I'm at Fox Valley Plastic Surgery. This is the Emsella. And if you would like to make an appointment or just get a consultation, give them a call today.
And website, Lisa?
Yes, it's fvpsurgery.com or just Google search Fox Valley Plastic Surgery.
And thank you so much, Nancy, for participating in this. And this is a really cool thing, you guys. This is, like they said, life changing. So come on out to Fox Valley Plastic Surgery.